to take a tooth pulled out or to have it restored. How to choose. When I look at a tooth that's been damaged, I don't jump straight into fixing it. First thing I ask is, does it actually make sense to save it? Can it function comfortably? Can it stay stable over time? Because if the answer to that isn't solid, everything else becomes questionable. From there, one of the biggest factors is isolation. And honestly, this is where a lot of treatments succeed or fail. If I can't properly isolate the tooth, I already know the result won't be predictable. So we do what we need to do, sometimes even adjusting the gum slightly using a laser, to get that clean, controlled filled. Then I check the gums. If they're red or bleeding, that's inflammation. And you don't want to build anything on top of that. So we slow down, take care of the gums first, and only then move forward. That step alone makes a huge difference in how long things last. Next, I look at the root. If it's on the shorter side, that tooth is taking on more stresses every time you chew. And over time, that can lead to movement or even loss. Position matters too. If a tooth is too far in or out, the forces on it just aren't ideal. And that affects the long-term prognosis more than most people realize. And finally, I think about the bigger picture. Can this tooth actually support a restoration, a crown, a bridge, something more demanding? If it cannot, I do not force it, because pushing a tooth beyond its limits usually backfires. At the end of the day, it's not just about saving a tooth, it's about making a decision that makes sense long-term. If you're dealing with something like this, it's worth talking it through with your dentist. There are usually a few different paths, but the right one depends on the details.